this video, I'm going to be explaining how melatonin works. So, in general, melatonin is an endogenous endoamine hormone that is synthesized primarily by the pineal gland in the brain, and its main role is to regulate the circadian rhythms, especially the sleep-wake cycle. Let's talk about its biosynthetic pathway. So melatonin is synthesized from the tryptophan amino acid through a multi-step pathway. First, tryptophan is converted into the 5-hydroxytryptophan through the enzyme called the tryptophan hydroxylase. And then the 5-hydroxytryptophan is then converted into serotonin, or 5-hydroxytryptamine, and this will occur through the aromatic L-amino acid decarboxylase. And then finally the serotonin will then be converted into N-acetylserotonin through the enzyme called the aroalkylamine N-acetyltransferase. This happens to be the rate-limiting step. And then the N-acetylserotonin will then be converted into melatonin. This will occur through the enzyme called hydroxyindoles O-methyltransferase, or HIOMT. So, to understand this better, just remember that the AANAT, or the aroalkylamine N-acetyltransferase, its activity is tightly regulated by the light-dark cycle, and that's because it is the rate-limiting step in the melatonin synthesis pathway. Let's talk about the regulation by the light. This is involving the retinohypothalamic pathway. So melatonin secretion is controlled by environmental light through a neural circuit. So light is detected by the intrinsically photosensitive retinal ganglion cells, or the retinal ganglion cells. They contain the melanopsin, and then the signals will travel through the retinohypothalamic tract to the suprachiasmatic nucleus. And the suprachiasmatic nucleus is the master circadian clock. And then from the suprachiasmatic nucleus, the signal will then travel to the paraventricular nucleus, or PVN, then down to the spinal cord, and then the superior cervical ganglion, or SCG. Afterwards, the postganglionic sympathetic fibers will release the norepinephrine onto the pinealocytes. So from the retinal hypothalamic tract all the way down to the superior cervical ganglion, which ultimately leads to release of norepinephrine onto the pinealocytes. And the origin of the signal is from the photosensitive retinal ganglion cells. So, in a dark environment, the norepinephrine will bind to the beta-1 adrenergic receptors, which leads to the increase in cyclic AMP production. This will activate the AANAT enzyme that we talked about earlier, which will then lead to increased melatonin synthesis in a light environment. So when it's broad daylight, this same pathway becomes inhibited, and obviously that's going to decrease the melatonin production. Let's talk about the secretion pattern of melatonin. So the melatonin is secreted in a circadian pattern. So the secretion of melatonin peaks at night, typically from 2 to 4 a.m., and then it is suppressed by light exposure, especially blue light. And then let's talk about receptors and mechanism of action of melatonin. So melatonin acts through the G protein coupled receptors. First we have the MT1, which is the melatonin receptor 1. Melatonin receptor 1 is located in the specifically, they are coupled to the GI protein, also known as the G inhibitory protein. This will decrease the adenylate cyclase production, thus leading to decreased cyclic AMP production. For physiological effects of melatonin, first we have circadian rhythm regulation. So melatonin signals quote-unquote biological night, and it is responsible for synchronizing peripheral clocks in the organs. Of course, melatonin will help to promote sleep. It does so by reducing the sleep latency, which is a term for the time to fall asleep. It also modulates thermal regulation by decreasing the core body temperature during sleep. And then it has some neuroendocrine effects. So, in particular, it is known to inhibit the hypothalamic pituitary gonadal axis, or the HPG axis. This is important in seasonal breeders, and it influences cortisol rhythms indirectly through some mechanism. And then lastly, melatonin has some antioxidant properties, so it happens to serve as direct free radical scavenger. And then it upregulates the antioxidant enzymes, such as a superoxide dismutase. And then for pharmacokinetics, it can be rapidly absorbed through oral intake of melatonin, and the half-life of melatonin is approximately 30 to 60 minutes. However, this half-life can be longer for extended release formulations. The oral form of melatonin will be metabolized in the liver through the CYP1A2 enzyme, which is part of the cytochrome P450 1A2 system. CYP1A2 is the abbreviation for cytochrome P450 1A2. And then for clinical applications, melatonin can be utilized for treating insomnia, especially latent sleep onset. It can also be used to treat jet lag,